It's time to wear a mask again, health experts say. A high-quality, well-fitting mask is your best protection against infection from the coronavirus, influenza, and RSV. Now, I just, real quick, this is the 30-minute COVID segment, so just brace for impact, put your seatbelt on, etc. Put your mask on for this one. If you were to poll America, what percentage of Americans do you think understand what a high-quality, well-fitting mask means? Because the CDC has pretty much never talked about what that actually means. They'll talk about, just get a high-quality N95 or whatever. But if you were to poll Americans, what percentage of Americans do you think actually know the correct answer as to what a high-quality, well-fitting mask means? I would go as far as to say maybe 5% know what that means. Maybe 10. Masks are back. Now, again, I talk about COVID a lot on my channel. Masks are back is just a hilarious way to introduce this. I mean, this is by Dana G. Smith up here, so probably a COVID denier. Masks are back, and this time they're not just for COVID-19. A, quote, triple-demic of the coronavirus, influenza, and respiratory syncytial virus known as RSV sweeping through the United States has prompted several cities and counties, including New York City and Los Angeles County, to encourage people to wear a mask in indoor public spaces once again. I love this, again, I've said this many times, but the average American is a toddler. Mentally, I'm willing to suggest that 95 to 99%, somewhere in that range, of Americans are whiny, poopy, butthole babies, okay? They kick and scream and poop their pants constantly when it comes to COVID-19 and other sorts of health issues, right? So the idea that we aren't saying, wear a mask when you go outside. Instead, we have to encourage them. The little poopy babies need to be encouraged to wear a mask. Now, again, I know I say it all the time. Imagine if you go to a restaurant and then you see a sign, like let's say you just ordered your food, you're waiting for the food to arrive, you're like, oh shit, I gotta use the bathroom, okay. So you go to the bathroom, and in or on the bathroom door, you see employees are encouraged to wash their hands. I'd be like, oh shit, cancel my order, I'm out of here. Why? Because if they're encouraged to do something, that means it's an option for them not to. Instead of employees are encouraged to wash their hands, what do we see? Employees must wash their hands. Why? Because the law is designed around actually caring about public health. But when it comes to a deadly virus, now again, what's the worst thing that can happen? Think about this. What's the worst thing that can happen if an employee doesn't wash their hands at a restaurant? Maybe they get some poop flakes on their hands, and maybe some fecal matter gets into your soup, right? Now think about this. Damage-wise to the human body, compare eating a bunch of poop flakes versus COVID-19, the flu, or RSV. Which one is more likely to cause a much more serious outcome? Just think about it. Just think about it. That's all I'm asking here. It's a thought experiment. Is it possible that the guy's poop flakes might have some other disease on it? Absolutely. But just think about, on average, if you were to run this experiment 100 times, 1,000 times, who is going to end up with worse health outcomes? Someone infected with COVID-19 or someone who had a couple poop flakes on their souffle? Right, so think about this, right? The more deadly scenario, and we have no protections on, isn't that weird? Right? Isn't that fucking strange? Isn't that a little fucked up when you think about it? Nationwide, COVID-19 case rates and hospitalizations have spiked by 56% and 24% respectively. Over the past 2 weeks, the CDC and Prevention estimates that there have already been 13 million illnesses and 7,300 deaths from the flu this season. And those numbers are expected to rise in the coming months. Over the past decade, annual flu deaths have ranged from 12 to 52,000 people, with the peak in January and February. And while RSV finally appears to be on the decline, infection rates are still high across much of the country. So I've said this before, and I know I repeat myself very frequently on this show, especially when it comes to COVID, that every year, Thanksgiving, Christmas, New Year's, right, the quote-unquote holiday season, every year the holiday season is responsible for approximately 40,000 deaths every year, whether it be traffic accidents, whether it be the flu, whether it be, you know, all sorts of viruses that are transmitted during the holiday season. Now, again, does it have to be like that? Am I saying we should cancel Thanksgiving? Well, yes, I think Thanksgiving is stupid, anyone who celebrates it as a low IQ. But I'm not going to go out there and say that no one should be allowed to celebrate Thanksgiving. That's a little authoritarian. But you know what isn't authoritarian? Saying, oh, when you go out traveling, let's say November all the way up until March, mask mandate. You have a mask off, you get fined. Is that simple? Why? Because then 40,000 people a year, on average, would still be alive. Now, since the COVID-19 pandemic, that 40,000 number has, I think some studies are saying that like 300 to 400,000 people have died because of dumbass motherfuckers traveling on Thanksgiving and stuff like that and not getting vaccinated and not wearing masks. Right, so again, I'm willing to say that everyone who died of COVID was preventable. It was all preventable. The government chose not to, and Americans more specifically chose not to. Let's imagine the government did do a lockdown that was actually, required, medically approved, made sense. Do you think America would abide by that shit? You had half the country crying and whining because they couldn't get a haircut for a couple weeks. So I'm just willing to say that any actual COVID-19 measures are just impossible given the IQ of the nation here. Right? But again, just think about it. Americans are poopy butthole babies, right? And the idea of wearing a mask to save 40 to 50,000 people a year, wearing a mask like when you're on a plane to them is so offensive. Wearing a mask when you're at the airport is so offensive that they're okay with 40 to 50,000 people dying every year. Now, again, this is before COVID-19, just so that they don't have to wear a mask. Why? Why is that the case? I don't know. You look at countries like China, Japan, South Korea, a lot of them, they wear masks all the time. So when COVID-19 came around, they're like, oh shit, let's go into our closet and get our mask collection out. Why? Because they knew this. They knew that, and they actually care about public health. Countries like South Korea actually give a fuck about public health. And so what they do is, as a culture, they wear masks all the time on subways and heavy transit areas. Why? Because they don't want to get fucking sick. And think about it from this angle. Like, Americans are so fucking stupid that even the selfishness, like this is why I don't necessarily call Americans selfish. Because if they were selfish, they would do different stuff. If they were selfish, they would wear a mask. Why? Because they don't want to get sick. If they were selfish, they wouldn't vote for Republicans and shitty corrupt Democrats. Why? Because they're just stealing their money. But Americans, they're in their own brand of stupidity, is like, in individual scenarios, they're selfish, right? But in a public sense, they are like suicidal maniacs, right? Like, you ever think about this? Like, Americans on an individual basis might screw you over and steal your money, right? They might rob you blind or whatever in any kind of way, right? But on a public health level, they're all just suicidal freaks, right? Again, suicidal freaks. They want not only to kill themselves, but they want to take out as many people as possible. Think about 9/11. Think about that, right? People blow up fucking the World Trade Center. Damn, huge loss, right? 3,000 people died. Not bad. But also think about COVID-19, right? How many people are being killed because other people are suicidal freaks? Now, again, suicide bomber versus suicide, virus replicator. What's the difference? Well, one is terrorism. The other is American. What's the difference? Tell me what the difference is. Going outside, knowing you have COVID, not wearing a mask, and killing people. What's the difference? I mean, again, you're killing yourself, but not only are you killing yourself, you're trying to kill as many people as you can with you. I don't know. That doesn't seem like selfishness to me. But anyway, let's get back to the article. That seems like a whole different kind of disease. The CDC officially advises wearing a mask on county-by-county basis depending on community COVID-19. They're still doing this shit. Millions of motherfuckers are dead, and they're still pretending that there's, like, community levels. Oh, like, they're treating it like it's a fucking video game or some fucking shit, which take into account virus-related hospital admissions. Now, again, the CDC, what does it stand for? Centers for Disease Control and Prevention. Prevention. The idea that the Centers for Disease Control and Prevention is going to tell people how many people are in the hospital as a way to make people not want to get the virus instead of, I don't know how many people have the fucking virus. What is the transmission rate? I don't give a fuck if Mary Sue down the street's in the hospital. I don't want to get COVID at all. I don't give a fuck if she is dying on her deathbed. I don't want to catch the disease at all. I'm not waiting 3 weeks until she goes into the fucking ER to fucking avoid that fucking bitch. I want to know as soon as she's got COVID, all right, fuck Mary Sue. I'm not knocking on her door anymore. Fuck that bitch. Right? But again, you know, no offense to Mary Sue's out there. But again, we don't live in that country. We live in a country where the Centers for Disease Control and Prevention, their official strategy to combat COVID is get COVID, but don't die. That's their strategy to prevent transmission. What? Like, it doesn't make any fucking sense. This is some Twilight Zone ass shit. It's weird. It's weird, okay? It's fucking weird. On NPR last week, Dr. Rochelle Walensky, the CDC director, said, "You don't need to wait for the CDC's recommendation, certainly, to wear a mask." Isn't that your fucking job, bitch? Now, again, I ask you this question. I'm working at Bojangles. What's Bojangles, you might ask? Look it up. I'm working at Bojangles. I got hired for the fry cook position, right? My boss comes in and says, "Oh shit, you've been day 2 of the job and you haven't done anything?" Like, let's imagine I'm sitting in the corner. Let's imagine I'm kicking and screaming. I'm crying in the corner. Wah! Wah! Right? Because I'm an American. That's what Americans do. My boss comes in and says, "Hey, aren't you supposed to be the fry cook?" And I'm going, "Wah! I don't wanna! Wah!" Right, that's my response. Now, imagine this. Would I still have my job after that? Think about it. If you just sat in the corner and had a temper tantrum and didn't do your job, you would get fired. Right? Right? I mean, that's what would happen to me. That's what would happen to you. You're the director of the CDC. You can do the same thing. Not, as in, again, not do your job. She is the director of the Centers for Disease Control and Prevention, and she's not doing her job. So, what do? Do we fire her? Oh, of course not. That would be political. Let's just keep paying her a government salary to do nothing. To do nothing. To do nothing. It's crazy. It's crazy. Like, isn't that your job? Like, again, that's her job. Her job is to prevent the spread of disease. And she's like, well, I mean, you know, you should have been wearing a mask for the last 9 months, but hey, who am I to say? What the fuck? Rates of COVID-19 flu and RSV, quote, may be more intense or a little bit less intense in some parts of the country, but really the entire country is being affected. Now, I ask you this question. Dr. William Schaffner. What the fuck does this have, like, what? Now, when you think about it from the position of every time you open your mouth, right? What is the goal? To transmit information, right? You have critical pieces of information that you want to give to other human beings. Now, I ask you this question. What the fuck does this quote, what does this mean? May be more intense or a little bit less intense in some parts of the country. So what does that mean? What this does is it allows any dumb fuck motherfucker reading this to go, oh, I think I'm in a less intense part. That's what this does. Oh, I'm just going to hope I'm in a less intense part. This is just copium for the dumb fuck motherfucking suicidal maniacs, aka Americans. What the fuck value does this saying this have? This is like an area where being silent and saying nothing would be more beneficial than saying whatever stupid ass fucking garbage William Schaffner just fucking said. But hey, whatever. A professor of preventative medicine at the Vanderbilt University School of Medicine. As a result, he urged anyone who lives in a high-risk household to put your mask back on when in public spaces. Now again, the idea that we have to put our masks back on, I've been wearing my mask the whole fucking pandemic. Why? Because I have 2 eyeballs and a brain capable of reading words, and I actually pay attention to medical studies. I pay attention to science journals. I pay attention to how virologists talk to each other about this stuff. And if I see virologists and epidemiologists and other sorts of people in the medical industry say, don't take your mask off, you know what I'm going to do? Joe Biden saying, the pandemic's over, Jack! Or, 99.999% of medical scientists, who am I going to support on that one? I know I'm not going to support who the CDC supports. The CDC says, fuck those medical scientists. That's why they fired 80,000 of them over the last couple of months. Again, the idea that you're going to trust senile, dementia, dumb fuck doofus Joe Biden over the entire medical industry. Like, again, this is like the climate deniers that are like, Donald Trump or the entire science people. What do they say about the global warming? Well, Donald Trump says we like clean coal, so I'm going to go with Donald Trump. Why? Because he's the orange man. He got billions of bucks, and he's just like me. He's like I'm an American. Like, what? Except this time it's Democrats that are anti-science. Like, again, who's taking their mask off and putting their mask back on in accordance with the CDC community levels? I ask you this genuine question. Has anyone who cares about the pandemic is someone like me that puts the mask on all the time. But I'm asking you, do you know anybody that's like going on their phone, oh, what's the CDC community level today? Oh, like, do you know anyone like that? I don't. Have you met anyone that's like, oh, what's the CDC community level today? I got to know whether or not to put my mask on. Right. But we're all supposed to live in a world where we pretend like that's normal. No one does that. The CDC knows that no one does that, right? So why is the CDC hell-bent on just providing medical disinformation like this? This is like a Ron DeSantis press conference or some fucking shit, right? Like, Jesus fucking goddamn Christ. Anyway, keep going with William Schaffner here says, high-risk households would include those with well, actually, this is not a quote. With adults over the age of 65, pregnant women, people with pre-existing conditions such as heart disease, diabetes, or lung disease, or anyone who's immunocompromised. Now, again, remember, the CDC director said, good news. Only the fat fucks and the disabled people are dying. Isn't that great news? Only people with comorbidities and risk factors are dying. Then you look at the entire list of risk factors and comorbidities with COVID-19, and you'll find out that 85 to 90%, some areas, right? You can make an argument that 90 to 95% of Americans have at least 1 or 2 risk factors that would put them at a higher risk of death. The CDC director's like, good news to all the vegans out there. We're all good to go. Good news. Everyone else is probably going to fucking die, but hopefully they don't read that because they're all fucking stupid. Like, I don't understand. Like, I mean, like, I just, like, what are these people doing? Like, I can't. Now, again, this is a New York Times article, by the way, like, just so, and we're only on, like, the 4th paragraph, so let me continue going here. Dr. Helen Chu, an associate professor of allergy and infectious diseases at UW-Medicine in Seattle, went a step further, recommending everyone mask while infection and hospitalization rates are so high. Quote, I think it's a good time to mask, she said, given where we are right now with the hospitals being very close to capacity, especially in pediatric hospitals with RSV and with flu. I think that anything you do to slow down community transmission is going to be helpful. Now, again, think about this, how doctors have to speak to Americans, right? Doctors have to speak to Americans like they're children. Why? Because Americans are fucking children. The average American can only read and write at a 4th grade level. Jesus fucking Christ, right? The average American is as mentally mature as the average 4 or 5-year-old. Let's be honest. You ask them to put a mask on to save people's lives, and they go like, freedom, right? Like, isn't that crazy? You ask an American to put a seatbelt on. I don't wanna. You ask an American to wash their fucking hands before eating. How dare you? Freedom, right? These people are fucking ridiculous. So this is how, like, what we have to deal with. Doctors have to treat these people like babies, except this is 90 to 95% of America. I'm sorry if I'm breaking news, by the way. Americans are fucking stupid. Yes, all of them, every single one of them. Like, and now, again, there is an exception that proves the rule. Some Americans have somehow involved themselves in this culture that we call America and have not been infected with the cringe virus. What is the cringe virus? It's called capitalism. It's called selfish, short-term fucking thinking. Now, again, how many Americans have gotten the new bivalent booster shot? According to studies, which, by the way, I don't even see that many polls or stat collection on this anymore, it's about 15% of the country even is bothering to take a free vaccine. A free vaccine. 15% of the country. Free. It's free. They're like, nah. 85%, I mean, are like, nah. Only 15% have gotten a free vaccine. Like, what do you expect me to say? What do you expect me to say about these people, this population? What do you expect me to say about them other than these are some dumb fuckface motherfuckers? Like, what do you expect? Like, seriously, free, life-saving vaccination? Only 50% have gotten them. Jesus fucking Christ! There is strong evidence that masks help to reduce the transmission of several respiratory viruses. One paper published in 2020 by researchers in Hong Kong showed that people sick with either COVID-19 or the flu breathed out fewer viral particles when they were wearing a surgical mask. Masks were found not to be as effective for the rhinovirus, though, which causes the common cold. A study of COVID-19 policies in Boston area schools found that removing a mask mandate in 2022 was tied to nearly 12,000 additional cases amongst students and staff. Wow. Huh. Isn't that crazy? Who'd have thought? When you're breathing viral particles in and out of your mouth, putting something on your mouth changes how many particles come out. Whoa! Like, again, I mean, like, how many Americans dispute the efficacy of masks, by the way? Now, again, actions speak louder than words, right? So all the liberals and Democrats out there that don't wear masks, they're as dumb as conservative anti-maskers. I don't care about your reasoning. I don't care how you got there. You're an anti-masker. You're a COVID denier. I don't care if you voted for Democrats for the last 40 years. I don't care if you consider yourself a union worker. You're a hardcore liberal. You're a leftist. You don't wear a mask outside. You're a QAnon conspiracy theorist. That's all I care about. That's all I see. I see a bunch of an ocean of QAnon freaks, okay? That's what I see. You're a COVID denier? Oh, who would deny COVID? Not a socialist. Like, a socialist, a communist would be like, oh shit, there's a fucking virus out there killing everybody. We as a community should be around to help people. Yet you see DSA chapters all over the country getting rid of mask mandates and saying it's too divisive. All that shit. But anyway, I don't want to go into that. But, like, think about this, man. I mean, it's crazy shit. It's crazy fucking shit. So I can read the rest of this if I want to. But, again, the idea that we're still debating masks in 20 goddamn 2, it's going to be 2023 in like 2 weeks, and we're still debating masks? What? Like, I mean, again, Americans, right? Americans are fucking stupid. Americans are fucking stupid. How do you explain this in any other way? Other than Americans are fucking dumb fuckface freaks. That's it. And if this, maybe this applies to other countries. I don't live in other countries, right? I'm an expert on American stupidity. I am not an expert on French stupidity or Brazilian stupidity or, whatever. So I'm not that expert. Maybe this applies to humanity in general. I'm not sure. But I can tell you about America. And America is a bunch of fucked up psychopaths, suicidal freaks, right? So I'm just saying 9/11's looking pretty good in comparison to what the average American is responsible for at this point. But anyway, I digress. Here's your 30-minute COVID segment for today.